as we look to bring back all of the talented and educated and experienced doctors and nurses around the world, in the U.S., London, and other places, to bring them home and to help us as we seek to treat Nigeria as well as the West African sub-region in the areas of cancer, cardiovascular disease, and hematological diseases. Nigeria is fortunate to have many very good hospitals that are general in nature. We have chosen to invest in a very large hospital, ultimately 500 beds, that will focus on what we saw as gaps in the care, and that is specifically in cancer and cardiovascular disease. The beauty of this is not only during construction will we be creating jobs, so we desperately need your help. We want to partner with you as we seek to get the message out to all of the excellent, skilled, educated Nigerians that are out throughout the world, to bring them home and to participate in this great project.
If we partner with NIDCOM, we would be able to not just take the message out that there's an organization that is here to help healthcare workers who are seeking fortunes outside to stay in Nigeria, but also to bring back those who are already outside. So that's the main reason why we're here, and I'm sure we would be able to get the help we need to take the message out and to tell Nigerians that the African Medical Center of Excellence is going to collaborate not just with King's College, London, but other healthcare institutions in Nigeria, and we would also be involved in training and research. Thank you very much.
In order for initiatives like these to come and to flourish here in Nigeria, we need to work together, development partners, federal government institutions, NIDCOM at the center of all of this, to create corridors so that initiatives like these can appear not just one by one or periodically, but in a systematic manner. And I think this is the dimension that we discussed with Madam Chairperson, and this is where we will continue working in the future, capitalizing on the initiatives that are coming from here, but also on some of the good practices that other countries have went through, some of the good examples that can be localized, can be adapted here, and that I know the federal government and Madam Chairwoman is very much open to implement here, so that initiatives like yours can receive support, the necessary support, and that we can bring the diaspora as one of the elements of the development of the country.
We are ready to work with you. We'll hit the ground running with you. You can count on our partnership. You can count on everything we can do to make it success. And it's particularly important because we're talking about the medical field. I mean, I'm sure you've heard all the stories. We're not happy about the fact that a lot of our medical personnel are leaving, but you know what makes me happy? They are leaving. Despite the circumstances, they are still some of the best wherever they go to. So those that are leaving to the UK, to Canada, get there and they excel. They wouldn't do that if the foundation was not right. I'm not sure if the foundation is as it should be. It needs to get better. We don't want breaks in studies and all that. We know we have to do better, but they are Nigerians and they are doing very well. And the beauty of this is, just as they are doing, they are still going to come back and be the ones to work in this African Center of Excellence. We should be proud of who we are as a people and the talent and brains that we have. Now, what we are trying to do is what we're going to do with you. How do we harness all this to the benefit of our own home country? So I'm proud of our brothers and sisters everywhere. They just need a better environment, and it's being created by government. And I'm sure in the next few years, we'll have positive stories to tell, particularly the health sector. I think even before you're coming, we must say we have about 10 hospitals that have been built, and there are Nigerians in the diaspora. Right here in Abuja, we have maybe about 5. They're coming to build these hospitals, populate them, and then they come from time to time, spend a few months, go back, consult and all that. So really, I'm sure that when we move on, we're going to be a destination for medical tourism, not to be going abroad, because we have everything. We have the people, we have the personnel, we have the population. So I'm hoping that the African Center of Excellence will be the game changer.